Senate Appropriations Committee will come to order. Adam, would you please take the roll?
Yes. Senators Black,
Here.
Hudson,
Here.
Bean, Brown,
Here.
Searpoy,
Here.
Crawford,
Here.
Fitzwater, Henderson,
Here.
May, Nurnberg,
Here.
Washington, Williams. You have a quorum, Senator, with 8.
Thank you, Adam. Everybody should have a spreadsheet in front of you. I saw it in most piles that will go over House Bill 2014, our fiscal year 2026 supplemental budget. I would ask Adam now to start through that. There are some changes that I'm going to recommend. Many of you should know that. You've communicated with me on some of these changes and some of them that didn't get done. I know we have members that may want to discuss those quickly as well. So Adam, could you please begin?
Yes, as the chairman said, you should have a spreadsheet labeled House Bill 2014 Fiscal Year 26 Supplemental Budget. My understanding, as the chairman said, most of these will be House positions other than those ones that he has noted that he will discuss. In Department of DESE, the House did a fund switch on 14.015, switched it from a federal fund to an institution gift fund. Otherwise, the House was the same as the governor in DESE. Higher Ed, there's one item, and the governor and the House were the same on this. Department of Revenue, the House did not make any number changes to any of those items. Transportation, 3 lines, again, the governor and the House were the same on these. The first item in Office of Administration, the House did a fund switch from Fed to other. Otherwise, the dollar amount is the same. The Veterans Electronic Records was the same. The next change within Department of Office of Administration was the Attorney General, Solicitor General space in St. Louis. They updated that number. They removed the space in the St. Louis region for the state office, the treasurer's office. And the Fletcher Daniel State Office Building, they just moved that to a new section. Just right below that, you will see 14.131. The State Fair bonding language correction from the governor, the House added the dollar, and it's my understanding that all parties are now okay with this language and should be okay for bond counsel.
Yes.
We move into employee benefits, and again, there are several items here. The House and the governor were the same on all these items. We move Department of Ag, and the first item, Animal Health Lab Fee Spending Authority. The House took this item out.
Adam, just a moment. This item that came out deals with New World screwworm, is what the money was put in the budget, and we hope that we don't end up having to have it, but I believe we need to add that authority back. I would like to not talk about it on the microphone other than say I've been one of the lucky recipients of people showing up at our ag facility as well as my house, and we bought animals that were determined hot and had to go through the process, and thank goodness, I know it's hard to believe, but I followed the rules and those animals weren't quarantined, thank God, because kids had spent money, my family had spent money, etc. And when those things happen, they happen immediately. We move livestock all over the United States. It comes from south of the border. So I'm asking the committee to support me in putting that money back in and then pray that we never have to use it.
And just a little note, an article I read on that, they're actually training dogs at the border to pick it up on livestock, the virus.
Be able to smell it.
Yeah.
Yeah.
The next item was related to the Great American State Fair. This was Governor's Amendment, $150,000 under Department of Ag, Most State Fair.
Okay, and committee, I've asked staff within the report, and I did have both Department of Ag and Department of Economic Development talk to me. This item is going to be run by tourism, so putting it into the Department of Ag, it was placed in there probably because it says what? State Fair. And that is, Department of Ag's not running this, so let's move this over to Department of Economic Development and Tourism, the people in charge of it. So I'm hoping you will support that change.
So that one will be moved to tourism. The first item in DED was the API, no change there. We move into public safety, and at the very bottom of the page, there was an update to moving costs to a state-owned warehouse for SEMA of $10,000 by the House. The top of the page is related to the disaster money for all the disasters, those several across the state, and the St. Louis one. There were no changes there. In Department of Corrections, they did a fund switch and reduced the fuel and utilities increase. And my understanding is the department can live with that for this fiscal year. No changes for the remaining items in correction. Then we move into Department of Mental Health. And the first change, they reduced the crisis counseling increase by $500,000. The next change that the House did was this internship program. The governor had it in section 14.265 lower on the page. They moved it to a separate section 2.42. The first change in the next change for mental health is CCBHO utilization increase. Again, they pulled this out and moved it to section 14.252, so a new section for that funding. Then we move into the facilities, and they remove the safety and security updates. So those are the differences you see for those throughout mental health for the different psychiatric and the treatment facilities. Department of Health is the next change, and again, it's they took funding out of 14.315 and moved it to 14.317, its own section, new section for that. We move into Department of Social Services. A number of items there. We move.
Senator Brown.
What? I've had some discussions with the department on this, but I'm still really unclear. You go down to 1434, adds up, I don't have my glasses, but roughly about $32 million. What's that going to do? I mean, that's a big NDI for a supplemental. I've been on here 8 years now, and I'm not sure why this isn't in the operating budget instead of the supplemental. And that's $32 million for an implementation, you know, for the income maintenance eligibility system updates and additional resources. What are additional resources?
So I know a lot of these, when you see HR1, is tied to the federal bill, that updating the system.
I get that. I
know.
was told that a dozen times on Monday, but is this to implement you know, to get, you know, in compliance with the existing system, or is this like for, you know, what's coming up next year for new vendors?
Yes, Senator, my understanding it is part of new systems and a new eligibility system, and I know the director, she is in the room if you would like to have more details on that.
I would like to know if this is going for the existing systems or a new system coming on.
Director, would you please come up? Thank you.
Good morning. Oops.
I'm not trying
Morning.
to put you on the spot here, but I know we talked the other day, but I thought this was less money than it was, but I mean, this is just that's a lot of money for an NDI and a supplemental. I've not seen that much since I've been here. I mean, this would typically be like in the operating budget, but so if you could just explain. And again, my question is, I don't know if you heard it, is this going to go to updating or getting the current system that we already have in compliance, or is this going to go to money that is going to be for like the new vendors that are coming on board? So go ahead, I'm sorry.
Yeah, no, appreciate the question, clarification. So I think we've talked about, and Adam clarified, this is for HR1 compliance for the Big Beautiful Bill in order to cost mitigate costs associated with the SNAP error rate and Medicaid eligibility error rate that will cost the state, if we don't improve, over $1 billion within 3 years in general revenue. And it also is going to get us in compliance in time for Medicaid work requirements, which begin January 1st of next year. So we have to start the work very quickly. And we are working with our current systems to update those. And I'll let our CIO, Toy Wilde, talk through that.
Good morning. So with HR1, the technical implementation is pretty complex. You have SNAP changes and you have Medicaid changes, and just currently in FSD, where we administer eligibility, we have 2 separate systems that process that eligibility. So in order to implement some of those changes, you have system changes that have to happen pretty rapidly. The deadline for most of the major changes that happen with HR1 is January 1 of 2027. There are also the work requirements. So at current state and SNAP, we administer work requirements, but we do not do that in Medicaid. There are no standing systems that have Medicaid work requirements other than a few states like Georgia and others that have had their state legislator implement that. So this is a completely new system build when you talk about the Medicaid work requirements processing. The other pieces that you have is that in the past, the flow of the communication that has to happen to educate, there's a requirement in HR1 on the flow of how you have to communicate and educate with that. It takes massive updates to your portals and your other existing systems to meet some of those core requirements. So when we talk about the systematic changes, we're expecting hundreds of use cases out of HR1, complete redefinitions of how we do income verification, and then aligning that with system changes. So the technical team started this process back in July. We did July to review the bills, spend time with our federal partners, and then August we did a system assessment. What in FSD could we update the system for, and then what would we need, maybe new system implementation to support that provision. We worked through that with all of our partners. Once that was established, we started meeting with CMS in September and October to normalize our plan to start applying for that federal 90/10 funding. We got through that process. We were the first state to get our expedited APDs processed and approved, so we have the 90/10 match to accompany what we are asking. This is the money that we would need to be able to use to start and contract and have the general revenue match to meet that requirement for the FMAP to move forward with our HR1 implementation. And in most states, if you're not starting by April and you don't have all of your contracts executed, you are at very high risk of not meeting the HR1 requirements, which would put your overarching FMAP at risk. So those would be my high level. I'm happy to have a deeper discussion because it is very complex. We're projecting over 200 different use cases and system changes that will have to be detailed out in different release items. But we are having to implement a new Medicaid work requirement solution because we do not have one. And no other states actually currently have one. They are either updating their E&E systems or they are creating and plugging in a work requirement solution to work with their eligibility and enrollment systems.
If you can, like Monday, maybe like afternoon, if you could come to my office, I'd appreciate it. Excuse me. Because I know this is a complicated issue, but it's just a lot of money. And I think we're at a point here, we haven't been here since 2019, and I'm the only member on this committee that was here in 19. We actually had to balance a budget with not a lot of, extra money. But, so I'm assuming the additional resources then is going to be like consultants and
It's
things
actually
like that.
technical implementation vendors. So one of the most complex things that we're going to do through this process is API development. So it's, I think of the HR1 bill as
Interfaces for the
Yeah.
technology, sorry.
Yes, thank you. Interfaces for the technology, and really it's a way to be able to shift the data. So one of the things that we've looked at, and the state started early on, is you could focus your time only looking at bringing up a Medicaid work requirement solution. But if you're not doing that while you're simultaneously addressing the SNAP and the Medicaid error rates and looking at what efficiencies need to happen with those systems and the 6-month redetermination, you're not, with the reporting years, you're going to see higher fiscal impacts. So what we're trying to do is get ahead and get those technical consultants in, and I would really say technical implementers. It's really not consultants. It's technical implementers in to set up all the needed interfaces between our current systems to get a better data flow, which should help improve those error rates. So those are some of the things, and that's just heavy amount of people because of the timeline. So one thing I would address, and we've talked to CMS about this, and that's why we really wanted to focus on the 90-10 match, is that the timeline alone from HR1 makes this much more costly, because the normal timeline we would normally have for something like this, we wouldn't need as many resources, but the density of resources to meet the actual January 1 timeline is what drives some of the upward cost as well.
Well, I don't want to take a lot more time of anybody's time here this morning, so I know everybody wants to get out of here today, but I appreciate if you'd come talk to me Monday, and I will have some questions. Tuesday, I think, is when
Absolutely.
we do your guys' operating budget, and appreciate you trying to answer some of my questions.
Yeah, thank you.
Yeah, thank you. Those questions and answers, if you can help relay them with me. I know Senator Brown will as well, but I'm asking to be kept in the loop, please.
Absolutely.
Senator Nuremberg?
Thank you. So I'm jumping the gun here a little bit, but is there an NDI in the operating budget as well for FY27 on this? And how much is that?
Yep, the continuation of the work is in the operating budget. So you've got the start within supplemental of, this is all, we try to keep all of HR1 implementation together. So in the supplemental, you see 132 million total, 9 million general revenue.
Yep.
In the operating budget, it's 306 million total with 46.5 million general revenue.
Okay, and then would you also just very briefly explain the potential of fines if implementation is not met?
Yes. So when the HR1 Big Beautiful Bill, we started calling it Working Family. We started calling it Public Law 1119- because there are several names for it, the Working Families Tax Credit Act. When that passed, they reductions in federal spending to balance out the tax cuts in that were reductions in federal funding for Medicaid and SNAP. And so some of those were costs that the state can't do anything about. So reduction in provider taxes, freeze on new provider taxes in future years, reductions, freeze on state-directed payments, a lowering in the cost of our SNAP admin. So we used to have a 50-50 match. In October, that will become 25-75. So the federal government will put about $40 million annually just on the administration of the SNAP program. And then in the SNAP program specifically, they are looking at a state match starting not this next fiscal year, but the next, and it's related to your SNAP error rate. And your SNAP error rate is about how accurately you calculate the benefits for someone. So this has a lot to do with how good your technology is and how much staffing resources you have in determining the actual benefits, because if you don't have the income and the deductions for someone's income correct and their family size, then you are off in the calculation, and that counts towards your error rate. So they did a kind of staggered error rate implementation, and so Missouri's current error rate would put, or the most recent federal fiscal year that we had, would put us at FY28 $232 million annually in general revenue that we would start paying in the SNAP benefits if we don't improve our SNAP error rate. So we have looked at all of the ways that we can start improving that. The Medicaid error rate is done through the every 3 years, and so that starts in FY29, but it's based on the year they'll be auditing this next year when they do that 29, because they have to look 18 months at least. You have 18 months to bill in Medicaid, and so they have to kind of go back on the auditing year. So when you're looking at that, the resources that have been put in the past towards Family Support Division in processing Medicaid annual renewals and making sure that we were caught up in that area, which is something the technology is going to help us get quicker with, is that we are, let's see, last perm Medicaid audit that we had in FY19 that is comparable, because you can't count the years that have COVID, public health. That is an error rate that would have put us at having a $1.3 billion federal clawback. And the majority of that is all related to being behind on Medicaid annual renewals.
Okay, and I know we'll talk more about that in the operating, but yeah, okay, thank you.
Senator Brown?
Just one more question here. Can you provide the committee, or at least me, and I can get it to them, the error rate data?
Yes,
Yeah.
we did provide that during the presentation to the House, and I think
Because this
we
is
may
a
have sent
very
Adam and
confusing.
Dana
Yeah,
the-
it's a very confusing, issue here. But I mean, we're also talking about hundreds of millions of dollars, that we have to be a little more responsible with. And
Yes.
I can't get out of my head when you guys keep saying that, we only have till January 1, and we're going to start completely over, so we can build a whole new system in less than a year, instead of just building on what the current system we have.
No, I apologize for any confusion. This is updates to our current systems and additional software to create interfaces from those systems so that we can do.
But if we start changing vendors, then they're going to have to implement that too, to be able to be in compliance by January 1, I'm assuming.
So we
So
have
our-
2 vendors for eligibility systems. Go ahead.
Yep, so we are stabilizing our E&E system. So the plan is we are to take strain off. So just so we're all on a level set
Yep.
place, our E&E systems are like 40 years old. So-
Eligibility enrollment.
Yes, thank you. Eligibility enrollment systems are like 40 years old. It's very complex to change them, and it's very complex to find resources to change them. For our famous system alone, which processes SNAP, non-MAGI, and TANF, it takes over a year to get a developer in. So we don't actually technically have, most of the time, a ton of resources to actually make updates and implementation pieces with that. We have maintenance and operation contractors that come in and help support it. But what we really focused on was keeping those systems stable, making the business operation changes needed, and getting the data flow back and forth to them, so that once we have HR1 implemented, and there are updates that happen to these major systems, because we are on an MMIS modernization journey, we will be at a spot where CMS has had very detailed discussions with us about our non-MAGI and our MAGI program are in 2 different systems. From a federal perspective, that is something that they are not going to probably allow us to stay on for a much longer term. So what I was trying to do when constructing the design with this is I didn't want to build every single work requirement into eligibility systems that in probably the next 3 to 5 years, we are going to have to streamline, replace, look at what the feasibility of keeping those, because you have separated Medicaid programs that CMS isn't going to want to see those separated anymore. So what we're doing is we already have income passports. So there's not very many new vendors that are being added into the atmosphere. So we already use SteadyIQ as our income passport for 1099 income. This is building off of that income passport, and we're already working on the APIs needed to integrate with Medicine Famous. So the priority resourcing was get the staff that we have that are highly trained in our Medicine Famous systems, get them developing these robust generic APIs that can handle this data exchange, and then use some services to plug in for verification, for work requirements validation. But it was a really intense process over about 2.5 months of really setting down, aligning what is the actual capability and resources for success. We did just have a pretty detailed discussion on Tuesday with CMS leadership about our plan, going through all of the pieces, really line-iting out with our technical team how this could be done. I think the biggest hope that I have is if supplemental is supported, we can get the contracts moving. We're ready. We have to ensure that in collaboration with you all and our federal partners that we're moving it along. But that was really our concern with supplemental. I think normally if HR would have hit at a different time, I do agree it might have been a better option. to
Well,
put in a
this
different
should have
budget.
been in the operating budget, and I get
Yeah.
that, but I don't agree with this being in the supplemental. We haven't had time to vet this, and
Yeah.
I mean, I'm going to go along with the chairman, but I can tell you, we need this error rate data by like tomorrow.
Okay.
Yeah, we've provided that in private meetings to anyone who took us up on an offer to meet prior. I know Senator Hudson and I had some time together, and Senator Searpoy and I think I have Senator Washington tomorrow. So today, it's later today. My calendar's got a little bit crazy, so, but yeah, we will come meet personally with anybody who wants to talk about HR1 impact.
We have one more question
Yeah.
on this that I know of. Senator Searpoy?
Chairman, this will really be easy, and it's probably the wrong time. I'm just curious, why, and I hear this over and over and over again across the state government, why are we inventing this stuff? There's 50 states out there. Does nobody do this well? We can just say, let's do that? Why do we always have to invent this stuff?
So I would say we're not reinventing, but one of the things that we are looking with CMS is baseline with this system is every state does have different systems implemented. So taking into conjunction with what systems we have, one of the goals that CMS has done is they have really worked with their state agencies. So we met in November, worked with state agencies, and they really put some pretty specific parameters for vendors who are coming into the space to create technologies, to do income verification and work requirements for Medicaid and make that more of a seamless process. They put out a lot more stipulations, and what their ask were was make sure that you're integrating, but the timeline change is really what I would say is the most difficult piece. What we're hoping are, we actually met with a couple states, I just met with a couple states last week, so what we're really looking at is depending on where you're at in your modernization journey, and this takes you back to CMS's modular approach to implementing. So we have Medicaid enterprise systems, and that's how you get the 90/10 funding from CMS. So all of your systems have that. There is what's called MIDA. It's basically a technical architecture of how they want to see Medicaid systems be updated, secured, controlled, all of those things. So you're on a modular journey to update all of those at different places. What we are seeing from CMS is in the past, to be honest, and this is before my time frame, CMS allowed states just to choose their journey and choose where they went. So coming into something as high magnitude of the changes that are hitting with HR1, I was very concerned about utilizing where we're on with our MMIS journey for the E&E system. I did not want to do a massive update to that because I knew that we were already in pretty detailed discussions with CMS and their strong recommendations that the state had to get the MAGI and non-MAGI programs into one system.
Thank you.
So I hope that helps. with a little
And
more
just as a
detail.
final statement, your mastery of acronyms is amazing.
I'm sorry. And please call me out if there's any that you're like, what is that? I'm very technical by nature, so I'm sorry.
Not today, but maybe at the next meeting.
Yeah.
In your department as well as everybody else, and a lot of you are here, you hopefully understand the angst as we've moved through these IT systems, especially somebody like me. It seems like I'm writing a check for nothing, for something I know nothing about. And then, as you know, many of us have a little bit of heartburn over the movers process, et cetera. So every one of these goes to the top of the flagpole. So with that, is there any more questions? Otherwise, let's move on, Adam.
Thank you. So then we get into the Medicaid program where the House adjusted numbers based on another month worth of data. So that would be through the rest of the page. We're on page 4, Senator. And we move to page 5, managed care. There was the adjustments there. And then the second item for managed care, tobacco settlement, GR pickup, there was a later governor's amendment that we are not going to receive as much tobacco money as we originally anticipated. It's going to be less. So in this one, we would need to go with the governor's number on that one. And then hospital care, again, the first two are adjustments. And then again, another tobacco settlement pickup, governor's amendment. We would need to go with the governor's number of 29 million and some change there. The remainder of social services, again, is updated numbers based on another month's worth of data. We then move into the General Assembly, and there was a governor's amendment added here. The House removed that. Next, we move into FMDC. And again, the first item that the House removed was for DSS protective equipment warehouse disposal. My understanding it's not needed. We move to page 6. And the adjustments in FMDC correlate to the changes in House Bill 5 that you've seen earlier for the Attorney General, Solicitor General space and the State Treasurer's office space. The House updated the Attorney General's number and removed the State Treasurer's office item. And then the last item on that page was a Governor's Amendment for the Owner's Rep State Capital Master Plan.
Okay, and committee, I'm recommending we remove that at this time. I don't know for sure whether we ended up with the exact number, and I've talked to the people that were part of that, and I think we'll be able to survive that at this point. So I hope you will support that as well when we get into our executive session here, okay? Any questions on that? If not, Adam, is there anything else we need to add?
Now, we will take the changes that were discussed here and roll them into a Senate committee substitute for you to turn in.
Okay, we need to go into executive session then, and I will ask if there's any discussion after we do that, if we support going into executive session. I move that the committee go into executive session. Do I have a second? I have a second. All those in favor say aye. Aye. Those opposed, nay. The ayes have it. Now I have a motion. I move to bring House Committee substitute for House Bill 2014 as amended from the Senate Appropriations Committee in front of us. I have a second. All those in favor say aye. Aye. Anyone opposed, nay? Now, House Bill 2014, going through its amendments, are in front of us. Is there any discussion about that before we move farther into the do pass motion? Discussion. We'll go back to ag teacher time. Now we have something to discuss. Okay. Nothing else? I make a motion to adopt the Senate committee substitute based on the changes. Is there any discussion? Hearing none. All those in favor say aye. Aye. Anyone opposed, nay. Motion carries. I now make the motion to do pass Senate committee substitute for the House committee substitute for House Bill 2014. Do I have a second? I have a second. Adam, would you please call the roll?
Sure. For due pass for Senate committee substitute for House committee substitute for House Bill 2014, Senator Black.
Aye.
Hudson. Aye. Bean. Brown. Aye. Searpoy. Crawford. Aye. Fitzwater. Henderson. Aye. May. Nernberg. Washington. Williams. That's 9 ayes, Senator.
Okay, 9 ayes and 0 nays. The motion carries. I now move that we leave executive session. Do I have a second? I have a second. All those in favor say aye. Aye. We're out of executive session. And now we will begin a couple presentations. So thank all of you for being here this morning and getting that part of our business taken care of. Okay, it will just, for those of you listening in, it's going to take us just a moment to make a couple changes. Then we'll be right back online quickly. I'm not going to call for a recess.
I'll ask.
Bless you.
All right, folks, we're going to continue. We're going to hear the public defender. Welcome, and please begin when you're ready.
Thank you, Senator. My name is Matthew Crowell. I'm the director of the Public Defender System. It's a privilege to be here today to go over our agency's budget. Maybe I need to talk a little closer. There we go. Sorry. Again, my name is Matthew Crowell. I'm with the Public Defender's Office. Mr. Chairman, if you'd like, I can go through each item, or I can just hit the new decision items. I'm happy to do either.
I'm okay with you just hitting the new decision items, but I'm going to look around and see if we've got any committee members that are opposed. I'm getting thumbs up, so new
All
decision
right,
items.
sounds good. Okay, so the first one we have is a comprehensive compensation structure that begins on page 20. This was our recommendation as well as the governor's recommendation, and this item is $7.2 million. It is paid for out of the Public Defender Reinvestment Fund, which is money that is dedicated to the public defender through the Constitution. Basically, the taxes that people pay on recreational marijuana, that comes to the portion of that comes to the public defender. We have found when we looked at our numbers that our attorneys and our staff have fallen behind other state agencies in terms of what the pay is, and so this is our attempt to get those numbers on par. So, for example, probably our biggest problem, excuse me, is turnover among our young attorneys. We start out our young APD, I say young, our new, they could be older, but we start them out at about 62,000. The average across the state is about 75,000 for state attorneys. And so we're asking to start our new attorneys at 75,000. So, and then we have adjustments accordingly. We also realize that our staff, so the non-attorney staff, are also underpaid in many respects compared to other state agencies. We also looked at prosecutors' offices as well and other nonprofit organizations to get these numbers. But again, the same thing with our staff. The numbers that we were paying were a little below the average, so this gets us to be competitive and to help address our turnover issue, which currently stands at about 23% turnover for the year. So pretty high turnover, which causes a lot of expense and delay in cases. So hopefully this will address that, and we'd ask that you all support that recommendation. Our next new decision item on page 32 is a new case management system. We are currently operating under what's called Lotus Notes. We've been operating under that for the better part of a couple decades. They stopped doing any real significant improvements in about 2011, and so it still works. It's a good data collection for us, but it doesn't meet the needs of our attorneys and our staff. And partly, so in addition to helping address turnover, we need to be more efficient, and we believe this will help us be much more efficient. $3 million is kind of our best guess at what the case management system will cost. We have looked to other state agencies, other states, public defender agencies, to get an idea of what the cost will be, and we believe this is kind of in the realm of what we would expect the cost. We are looking both at building our own case management system, as well as kind of looking at what's on the shelf already. So our request for proposal hasn't gone out yet, but should be going out very soon. Any questions about that? Okay, moving quickly. Page 49 is our next new decision item. This is for, we requested 35 new FTE mitigation specialists. Oh, and I should say that the case management system request, that $3 million, that is also paid for with our Public Defender Reinvestment Fund through the marijuana money. So there's no increase in our core budget or our general revenue requests. It's all out of the funding that's been set aside through the Constitution. This as well. So this is $2.5 million. This would fund 35 FTE. I'll point out that the governor's recommendation in this case was 20 FTE. We like the governor's recommendation as well, so we're not opposed to, I think the governor wants us to take a stair-step approach. Last year he approved 10. The legislature had 20 in the budget. He vetoed that to 10. We filled those 10 positions immediately. last July, and they've been doing amazing work for our agency, helping to provide mitigation support in cases. And what that means is these folks, they assist the attorneys in finding treatment for clients and helping find bond arguments to get people released from custody who are not going to be a danger or a flight risk. And they help reduce the ultimate sentences by providing advocacy at the sentencing hearing for the courts. So we think that this is an important program, not only for our clients' sake, but it's also a huge, I think, long-term savings to the state. Some preliminary results we've seen from this program looks that recidivism goes from something around 41% to 12% if you have proper mitigation work done in the cases. So we think this is money well spent. Again, it's money that's been dedicated to the public defender through the marijuana or the Public Defender Reinvestment Fund. We've asked for 35. The governor's rec is 20. Of course, we'd love to have 35. Our numbers are based on, we believe that if we had 45, so the 10 last year plus the 35 this year, that we'd be able to staff every office in the state that we have with at least one mitigation specialist, and also provide some to our contract counsel, because we do contract out a significant portion of our cases to private attorneys. And so we would like them to have the same available services that we would provide to any of our clients. So 35 additional would get us there. 20 would be a good stepping stone along the way, and we're happy to prove that we can put those resources to good use. So is there any questions about our holistic defense?
Seeing none.
Okay. Those are our new decision items. I'm happy to answer any other questions anyone may have.
All right. Any questions from the committee? Seeing none. That was easier than you thought it'd be, isn't it?
That was easy. Thank you. This was my first time presenting to the Senate, so thank you all for your time. and
Well, you did an excellent
consideration.
job. Thank you for being here. Thank you for your presentation.
Thank you.
All right. Next up, we got General Assembly.
So this one can be even easier and faster. There were no new decision items recommended in the General Assembly's budget book by the governor. He did not make any core changes. As you know, this book includes the budget for your expenses, your salaries, the Senate contingent, myself.
Right.
So the governor did not recommend that, but if you recall, there's the Citizens Commission, correct? And judges are set to receive 1% based on that Citizens Commission, and the salary of the state senators and state reps is also tied to that. So that's a question that I think each admin committee on the House and the Senate side will be discussing. So,
Whole 1%.
and this also includes the House budget, representatives, their staff. Joe Engler is in the room, Chief Clerk. Patrick is in the room. You guys all know him. And then it also includes the budget for the different joint committees, and which is JCAR, and the director of that is Sarah Shappy. If you don't know her, she's on my right, your left. And then behind me is the retirement executive director, Robert Coleman. Legislative oversight is Julie Moore. She's with the fiscal notes. The legislative publisher of statute is Matt Morris, and Sandy Lukanoff is in the room. And then the Joint Committee on Education is Mary Byrne. So that's what's in the General Assembly's budget. No new DIs, no core changes by the governor.
Any questions?
We just trying to figure out where I raised it, but
I think that's it.
Okay,
Thank you.
so I think next week we have Department of Transportation on Tuesday, and then Social Services on Wednesday.
Okay. All right. No further business today. We're adjourned.
now you know we need a raise.